Hello there. My name is Eric Jameson, and this is case study number 1 for SPCE638 Field Experience in Applied Behavior Analysis. The client I'll be discussing is a 5-year-old male diagnosed with autism spectrum disorder, and right now the primary concern is reducing his self-stimulatory behavior, and there's a lot of focus on teaching him context about when and where these kinds of behaviors are more socially appropriate and non-disruptive. When it comes to potential maintaining contingencies, it's difficult to qualify because it's self-reinforcing. Um, and sometimes his behaviors are focused on visual stimulation, other times it could be auditory, tactile, or a combination of the three. And besides self-stimulation, some of his behaviors may also be related to escape or attention. So when the client came to the clinic, the staff performed a functional behavior assessment, including like parent interviews and direct observations, and they paid special attention to how people were responding to his self-stimulatory behavior. And they used the VB map to assess to some degree his cognitive skills. Um, so when they were addressing his self-stimulatory behavior, they block and redirect when the self-stimulation is not appropriate and allow it when it is appropriate. And they intentionally create situations where he can engage in it with the goal of teaching him the context I spoke about earlier. So in time, he'll be able to discern whether a setting and a time is an appropriate situation to engage in that kind of behavior. So like right now they have him at a table doing work tasks, and he'll complete a lesson, get a quick break, then maybe do 2 lessons and get an additional break, something similar to that. Since the behavior is self-reinforcing, they didn't consider the environment to the same degree as if it had been escape or access. They did reduce. The therapist removed any distractions from the environment and shaped it in such a way that the client has room to engage in the self-stimulation behavior when it's appropriate. And they also removed any kind of low-lying tripping hazards or anything like that. The client is not on a rigid schedule of reinforcement. The breaks are the reinforcer, and they generally last between 1 to 3 minutes. And the goals right now are to increase the time that he behaves appropriately and also increase the time that is in between the breaks. So a normal day, and generally overall, they start with less work and more play, and then shift in the other direction, focusing more on working. Um, and for generalization, it's just really a lot of variety. Um, so they switch up as many variables as possible. They switch staff with him on different days, maybe switch staff in the middle of a session, maybe change rooms in the middle of a session, maybe have a different room each day he's there, and he's there Monday through Friday for a couple hours each day. And when it comes to maintenance, they focus on parent training and incorporating his teachers. So the outcome has been progress. The client has been able to work for longer periods of time with longer periods between his breaks and reduce the overall number of breaks. And when it comes to obstacles that the therapists encounter, of course there's time because behavior change can be slow. Consistency, as they have to spend a lot of time ensuring everybody's implementing the same things in the same way correctly. And teacher adaptation, as not all the teachers have been on board and supportive, I guess is probably a good word. And when it comes to modifications, there have been no real modifications to the intervention. No significant modifications to the intervention. And that concludes case study number 1. Thank you.